One of the biggest challenges our neighborhood faces is the language barrier. And I, as a liaison, a Latina resident and works in the community, I am able to present to them and be able to speak to them on what their rights are and what it is, and for them to understand what it is to have a healthy home. Make sure they understand, and there's that trust that we have already built with them, and they're able to receive this and be part of the program from Build.
So things we see in our communities, a lot of them contribute to asthma, mold, moisture, pests, lead poisoning, and Environmental Health Watch is working in communities to do low-level interventions when we have funding and education. So the data sharing there with programs like Build Health does a lot of collaboration with different organizations, and it's all a matter of data sharing, and I think it'll help bring everything together.
At the City of Cleveland, each partnering department has a role. Health for the well-being of the child, building and housing to enforce the housing code, community development to ensure that there's funding for eligible homeowners to fix up those houses. Collectively, we are working together to provide an inventory of healthy homes in the City of Cleveland for our residents, to provide healthy neighborhoods for our families.
The Cleveland Department of Public Health has collaborated with several city departments and other organizations to develop a data system that would allow us to collect inspection data on homes where families reside. This information will assist families in making informed decisions on where they live.
The Department of Building and Housing has been working with our Community Development Department, Health, and Law to break down the barriers between us so we can share information to create a healthy housing stock. This information is available to the public on the City of Cleveland's website. You can find out if a property is registered to rent, if it has any violation notices, if it has any current permits, and much more information. If you want to find out anything, please visit the City of Cleveland's website.
The environment in which a child lives is really critical to his or her health. And a lot of what we do as physicians is reacting to problems such as lead poisoning or asthma that are either caused or worsened by things in the environment. While we can and do ask about these kind of exposures in clinic visits, sometimes the exposures are hard to see or hard for the families to talk about. Having access to easy to use and well integrated information about the quality of housing will make it much easier for us to deliver effective care so that we have healthier families living in Cleveland.
One of the ways this project is particularly innovative is in bringing community level data about healthy housing to the healthcare system and to the clinic, enabling doctors to make better decisions in caring for their patients. And this is a particularly powerful use of data that we generally don't bother to do in healthcare.
One of the many steps that the Cleveland Department of Health has taken in order to prevent more children from becoming lead poisoned is that we have partnered with 3 of our local higher education institutions: Case Western Reserve University, Cleveland State University, and Cuyahoga County Community College. These partnerships have resulted in the development of programs and initiatives that will enable the City of Cleveland to enhance our education and outreach efforts so that we can inform community members as well as parents on things you can do from preventing your child from becoming lead poisoned.